When we talk about these sensory problems, it kind of comes under the umbrella of sensory processing disorder. And that's something that is listed in the ICD, but only under autism. Like if you look up the ICD-10 code for sensory processing disorder, it gives you the code for autism, even though we know sensory problems occur throughout like all kinds of different conditions, right? So what's that all about? The DSM committee rejected sensory processing disorder back in 2013 and only left this kind of connection. The only thing that's left is this connection through ICD-10. There's an entire industry of sensory integration occupational therapy that's been doing their own research on sensory processing disorder for many decades. The question is, can they break into the other journals? Well, psychiatry hasn't allowed them, and I don't know if they've tried neurology. So it's kind of a problem. So the real question is, so what's the evidence for the use of sensory integration occupational therapy, or even the consideration of these sensory problems we're talking about in evidence-based practice? And I would argue that some of the OT research just isn't getting listened to, which is a problem in science, but also that the evidence base for developmental relationship-based interventions uh, includes consideration of sensory processing as a foundation for many of those approaches, which do in fact have a reportable effect size for social communication. So we do have evidence that this can be incredibly helpful beyond clinical experience.